Hello, welcome to our episode. This is season two and episode four of our podcast, and this is the K Vision podcast. And we are here to energize you and hopefully inspire you with new ideas in the eye community, and hopefully bring up our care for our patient that much higher. And today our topic is inclusivity for all and career growth for all in an eye practice, and including diversity and leadership in that field. And together with me is my wonderful guest from Dublin. He is an eye consultant and eye surgeon at Dublin Wellington Eye Clinic, as well as the Royal Victoria Eye Hospital. Welcome, Brendan. How are you today?
Thanks, Tina. I'm very good, thank you. It's good to see you again.
Yeah, you too. So, can you? I know we are collaborating for our upcoming SCRIS Diversity and Inclusion and Leadership instructional course. Can you tell me how you came to support us in our journey within that, and how that your role in the clinic has informed you in that role?
Yeah, sure. So I suppose I've always felt like I've been in a really, really privileged position my whole career, my whole life. I've kind of grown up with a mentor in the field who's very, very generous with teaching and opportunities.
Yeah,
And so I suppose sometimes if you develop the insight that you are in a really privileged position, it often highlights when people aren't in the same position. You can see that people aren't getting the same opportunities as you.
yeah,
And kind of very early on in my training, one of my colleagues on the ophthalmology training scheme left the scheme
yeah.
for a reason that would not have affected a male person.
Mm,
And she was a really excellent doctor,
yeah,
a lovely kind of person to work with. And she had had a child, and the training scheme wouldn't facilitate her staying in the city where her husband and child were living and
yeah.
wanted to send her abroad. And she just left the scheme.
Wow.
Um, and I just felt that that was extremely unfair.
Yeah.
And I felt it was really short-sighted. I mean, we need to train more surgeons, we need to train more doctors.
Yes.
She was obviously someone who interviewed well enough and had a good enough CV to get onto the training scheme, which is quite competitive.
Yeah.
And it just seems like sometimes if if the people in leadership positions aren't aware of how important it is to retain good people,
Yeah.
that you will lose good people in that process. And I suppose I've always had that in the back of my mind.
Yeah. Yeah.
Um, and then joining the clinic, um, I've seen how Arthur leads and how inclusive he is and how humble he is and how approachable he is and how many voices are given a podium to speak
Yeah.
and how positive that is and how great an atmosphere it creates when everybody feels valued in the clinic.
Oh,
And
amazing.
inclusivity is a huge part of that because
Yeah.
we're all different in ways that we can control and ways that we can't control.
Yeah.
The quicker that we realize that when people feel safe and happy and valued at work, they work better.
Yeah.
It just makes all the sense in the world to try and get involved in it.
Yeah. So you've come into the Wellington Eye Clinic quite recently, but you've
Yeah,
seen your father, Mr. Cummings, Arthur Cummings, build it up and grow it for the last few decades, I'm sure.
yeah, yeah.
And what would be the way you, as a leadership team in that organization, and that you foster that diversity and empowerment and leadership within your team?
Um, I suppose we try to do things as authentically as possible, um, and that really means that everybody on the team is given quite a clear understanding of what the practice is trying to achieve, so that the
Yeah,
type of service we're trying to deliver. Um, and I suppose it starts at the top. Arthur really leads by example in how he deals with people, how he approaches problems, how he um, tries to accommodate people as much as possible, but then also
yeah,
puts the patient at the forefront of things. So I think when you're all kind of looking in the same direction and pulling in the same direction,
yeah,
if everyone understands the role that they play,
Yeah.
It makes coming to work empowering.
Yeah.
Um, in a medical field like we work in, we're really, really privileged to be able to positively impact people in our day-to-day work.
Exactly.
Every day we get to make some people's lives a bit better.
Yeah.
And even if you can't make their lives better, the way that you treat them, you have an opportunity to be kind to everybody that you meet.
Yeah.
And I think if you work in a practice where the leadership behaves like that,
Yeah.
then you start to realize that actually it's quite a selfish thing to do. The more you help people and the better you treat people, it actually makes you feel better about your own contribution to the team.
Yes.
So everybody on the team is told how important they are in the whole patient journey, and that it's
Yeah.
a whole team that's delivering the care. And I
Yeah.
think when you obviously you need a figurehead in a clinic to be
Yeah.
the driving force, but when that figurehead kind of purposely dilutes their ego
Yeah.
and puts the team aspect of it first,
Hmm.
it's just a really, really good environment for everyone to feel like they're an important part of the team. And
Okay.
that then, in that fosters inclusivity and, obviously the diversity is something that we don't um, consciously go out and try to find people who are diverse, but making an environment where people who are diverse feel welcomed
Yes.
is as important. You can't manufacture diversity, but if you make diverse backgrounds welcome,
Yeah.
it has the same impact, I think.
Yeah. So from the bottom up, so your front staff and your receptionist,
Yeah.
they feel, do they have like a journey or a career mentoring while they enter your organization as the other people in the hierarchy do as well?
Yeah, that's it. So, I mean, we have obviously we have about 27 staff in the clinic, and
Yeah.
so the administration team have a manager
Yeah.
who kind of leads them, and there are different levels of hierarchy. So people are involved in training new staff,
Yeah.
and so there's a career path there.
Yeah.
I think probably our greatest example of career progression is our current clinic manager,
Oh yeah.
um, Liz Hogan. So Liz joined the clinic. I'll get the year wrong, but um, I'm, I'm, I think probably sometime around 2010.
Okay.
And so she joined as a technician. So she was
Yeah. Wow.
doing scans and, bringing patients around.
Yeah.
And Liz is a really kind of intelligent, hardworking person, and very emotionally intelligent. And so this was kind of picked up that this person had a lot of talent. Um, and many of our technicians come onto the team as kind of science graduates.
Oh wow. Okay.
We kind of started employing science graduates around the kind of crash, like 2008, 2009,
Yeah.
where science graduates were finding it difficult to find jobs. And so
Mm-hmm.
they kind of have the science background, kind
Yeah.
of learning a little bit of clinical stuff was very useful. And then most of our technicians will stay for, maybe 2 to 5 years before they move on.
Wow. Okay.
And we've had technicians do masters with us, they've done PhDs with us and kind of move on to work in big companies, run research trials.
Yeah.
Many of our technicians did research trial master's degrees. But
Wow.
Liz eventually became the deputy manager.
Yeah. Huh?
So, and then she became the manager. So she's kind of almost worked in every role in the clinic. And that is so, so useful. Hiring from within and promoting from within
Yeah.
means that your leadership is so connected to the whole team
Yeah.
because, if things get busy on the floor, she will get out of her office and she'll start doing scans.
Yeah.
Um, and she can solve any problem because she's seen them all before in all her different
Yeah.
roles. So
Yeah.
I think that's really important for the current staff that we have, that they can see that people are progressing through, because we have hired some really, really talented people.
Amazing.
Um, and yeah, we've our current nurse tech team manager
Yeah.
also started as a tech, and we've kind of tried to promote from within as much as you can do. Yeah.
Excellent. So that not only empowers them, that it helps you with your staff retention as well, doesn't it?
Yeah, absolutely. Yeah, yeah. So, and one of our optometrists has been with the clinic since before Arthur. Well,
Oh,
maybe
wow.
not before Arthur, but for at least more than 20 years.
Amazing.
Um,
Wow.
and
to
that breadth of experience also helps the new optometrists
yeah.
see that, look, this is not a place that you have to work for a few years and you move on. They
Yeah.
can kind of see them going through all of life's changes with the same job.
Excellent, excellent. I remember as a trainee coming back from um, pregnancy and maternity, there was there's no coherent, you know, getting people back to work in NHS. It just depends on who you get and what the middle managers are like, and there's no set structure when I was coming
Mhm.
back from maternity, and it's really humbling and inspiring that these things are taken into account now, and people returning back to work is more phased, and there's a lot more things around to support trainees coming back from maternity. But when I was doing it, there was nothing. So I remember once I was pumping, and I thought the room was safe, and someone just walked in. So it is ridiculous, the
Yeah.
whole situation. So I'm happy to hear that things have moved on quite a bit to support women coming back after maternity.
I think in Ireland's public hospital system, I'm not sure it's that good for trainees either. I suppose that's one of the beauties of private practice,
Yeah,
is that we get to set the rules and we get
yes,
to you can quickly adapt things. And if you see something's not working, there's not like 50 committees that has to go through before it gets approved. So I think we have a very I mean, I really, really respect the approach that Arthur's taken to maternity leave.
yeah,
Um, and also parental leave. So when Liz had her first child,
yeah.
rather than hiring somebody in to replace her as manager,
Okay.
our three managers stepped up and took parts of her role.
Oh, amazing. Okay.
And what happened there was they got to learn more about the management. The
Yeah,
people below them got to, get more involved in more senior roles. And
yeah,
actually, when Liz has come back, she has more bandwidth to do more things because some
yeah,
of the things that she had been doing are now being taken care of by the managers who took her role for the 9 months that she was at.
yeah,
Um, but also we have, many optometrists, many of our optometrists are female in our starting families.
yeah,
And so, we are really, really very happy with our optometrists. They've all been with us for a while. They all understand the clinic's ethos.
yeah,
And it takes a while sometimes to get people really up to the standard that you want.
yeah,
And trying to train somebody from scratch is much more difficult. So as long as we can retain optometrists,
yeah,
it's in the clinic's best interest.
yeah,
So yeah, as you was mentioning, we have phased returns.
yeah,
We allow people to work part-time for a while they're
yeah,
getting used to creche drop-offs and pickups. And
yeah,
for people who have children who are in school going ages, they are allowed kind of later starts. We try and be as flexible as we can be while not compromising the clinic as a business, but
yes,
also, where we can, being adaptable. And
yeah.
then we also we allow people to take a year of parental or maternity leave,
Wow, that's very generous.
which which is also it's really appreciated. That when people
Yeah,
come back, they're really wanting to give back.
yeah,
They want
exactly.
to hit the ground running and contribute. So
Yeah,
it just fosters a really nice environment, I think. But the other thing, apart from it fostering a nice environment, is that it's really important because, having having children and your life progressing shouldn't be a barrier to you being able to work
yeah,
and
exactly.
and and do your best in the work side of your life. I mean, obviously I've never gone through it, but I can really empathize with how difficult it must be coming back when you don't have that supportive an environment because you've got pressure from both sides like you've never had before. And you're expected to do the same job
Yeah,
while also having this other huge responsibility. And,
yeah,
you know, I think it's unfair on mothers much more than fathers that we expect them to do everything all the time. And I
mm,
think you kind of have to, as a business, recognize that, your people are your most important asset
yeah,
and that it's difficult in the early years to be a full-time employee when you have all these other responsibilities.
yeah.
So yeah, I mean, like I said, I really, really respect the approach that Arthur's taken. And I mean, I'd like to think that I would have done the same thing if I was in the leadership position, but it's really inspiring to see somebody who, obviously is a business owner. This is
Yeah,
a
yeah,
private clinic, um, put the team before numbers.
yeah.
Um,
Absolutely. So we talked about the front staff and your techs and your optometrists. What about
mm,
you as a surgeon? Do you feel that there's definite career growth within that organization, or do you feel a little bit under the shadow of the great Arthur?
mm. So yeah, um, I I think once I thought about it objectively
Yeah,
and kind of removed myself from the scenario, I realized how silly it was for me to ever see that as a burden, um, because it's an incredible place to work, and I mean I see myself being here for my whole career.
amazing.
Um, so I definitely want to stay here. I hope Arthur stays as long as he can, but I definitely see myself working here.
Yeah.
I don't think I have the same broad shoulders that he has,
Hmm.
uh, in that he's been the kind of sole surgeon for different periods during the clinic's, history. I mean, he joined, there were two surgeons, and then it was three for a while, and then two, but then it was one for a while. And he's been like the only surgeon here for probably a decade of the clinic's
Wow.
existence.
Yeah.
I think that's a lot of weight to burden.
Yeah.
So my plan for the clinic is not that I'm going to try and do the same thing that he's done.
Yeah.
My plan is to involve more colleagues and
Yeah.
have people join the clinic, even if they're not here on a permanent basis or a full-time basis,
Yeah.
but at least have a few surgeons involved. And um, I think that's probably because I've gone through the Irish training system. I think when you come as an outsider, I mean, Arthur was not really
Yeah.
welcomed with open arms to Ireland by
Yeah.
the rest of the ophthalmic community, at least in the
Yeah.
early days. Things have changed now, but
Yeah.
he had to kind of fend for himself.
Yeah.
Whereas I think I've gone through the whole system, so I have a network that he didn't have access to, and
True.
I think leaning on that network and involving that network is kind of a nice way of continuing on in the clinic.
Amazing. Amazing. And in terms of those potential surgeons joining your clinic, what would be your advice for someone who's looking for career opportunities and growth within the organization?
So I suppose we have a fellow who's just joined this week,
Oh,
from
wow.
the UK.
Yeah, amazing.
So I suppose Arthur's had three fellows. I was the second, and now we have a fellow, and she's an incredibly impressive person, I must say. We feel very, very lucky to have her. But she came to the clinic to visit when she was in the final year of her training.
Oh, yes.
So
Yeah.
she kind of contacted the clinic and asked if she could spend a week or two here.
Yeah.
Um, and I suppose giving advice would be to try and emulate what she has done. So reach out to somebody who you feel can mentor you. I think in our field, mentorship is really, really important.
Yeah.
If you can find somebody,
Yeah.
cataract and refractive surgery is, there's so much to learn that you don't get during your kind of ophthalmology training, that
Yeah.
learning from somebody who's in the field is hugely valuable when you're starting out.
Amazing.
So kind
Yes.
of, make contact with people, and then,
Yeah.
I mean, uh, I don't think this is usually an issue for uh, women. I think it's more of an issue with men, but women tend to, um, because of the fact that unfairly men are given more authority just based on gender. I don't know if it's the
Yeah.
deepest of our voices or whatever it is.
Yeah.
Many, many women feel like they need to really, really over prepare.
True.
You find many men will use confidence to kind of slide through a situation,
Yeah.
and women will have done the groundwork and actually know the stuff. In my
Exactly.
experience,
Yeah. No,
women very, 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 very rarely try and bullshit their way through something, whereas many men will try and get away with that.
I know most women will have to be 100%
Yeah, exactly. Before
material
they feel
for you
confident to,
attempt.
yeah.
Yes. Yeah. Yeah. That is true. That is true.
So I suppose, trying to do some groundwork and prepare yourself in it, and then show interest. I mean, well, Charlotte was in the clinic last January,
Yeah.
just she really fit into the team culture. Like she was so
Yeah.
helpful with everything. Outside of her
Yeah.
kind of duties, she'd be getting coffees with patients if they were, just trying to be overall helpful.
Yeah.
And
Yeah.
that's the kind of atmosphere that we have here.
Oh, lovely.
But I think finding a mentor and then, uh, you know, this is a really patient-focused type of ophthalmology.
Yeah.
Private practice refractive surgery
Yeah.
is not pathology based. It's really trying to solve people's individual problems and getting on
Exactly.
board with the fact that you are not a hero in the situation. You're rather trying to solve a person's frustrations.
Yeah.
Having that kind of attitude,
Yeah.
um, is the advice that I would give. I mean, or be born Arthur's son, and then it's very easy,
Excellent. So in your establishment, obviously in the eye clinic, diversity and meritocracy is not exclusive. They're more inclusive, um,
Mm,
mutually inclusive.
yeah, yeah, exactly.
Yeah.
Yeah, no, I mean, if yeah, we will we try to empower and promote people from within if they are showing that type of ambition. Yeah.
Brilliant. Okay. Any other top tips for our listeners, and why should the 15,000 ophthalmologists and other professionals coming to ESCRIS come to our course on the Monday, the 16th of September?
So one thing I will maybe finish on is that, um, if we want our teams and our clinics to really, really take care of our patients,
Yeah,
that doesn't happen unless we really, really take care of our teams.
exactly.
People who don't feel cared for in work and really, really valued,
Yeah,
it's difficult to, over a long term, give and I suppose take care of patients on an ongoing and sustainable way.
yeah.
Because people will quickly feel like, look, I'm just giving here, not getting anything, and then people kind of get a bit of burnout and they maybe tire from that. Whereas
Mhm.
if you really, make your priority
Yeah,
making sure your team feels very well looked after, it is contagious. Then you just want to pass on that goodwill and that care to your patients, and it becomes kind of a self-fulfilling prophecy then. Um, so having a team that is very well valued, and I mean a huge part of that value is being inclusive and diverse and making room for all different types of people and helping them to feel like that they're a key part of the team. I
yeah,
think you'll find that your patients benefit from it, and
yeah.
that's why we're all at this conference, or why we're going to the conference, is because we want our patients to benefit from what we've learned.
Excellent. Thank you very much. So thank
Thank
you
you,
for your
Rebecca.
time, Brendan, and we'll see you soon. Thank
Yeah,
you.
great to see you again. Take
Take
care.
care. Bye now.
Bye bye.